Hi, hi, hi. Welcome to our YouTube channel. Today we are going to discuss about the topic of vaginal yeast infection. This is a common infection that most women develop, especially for pregnant women, and this is very important for my audience to discuss about it, about the cause of it, prevention, and the treatment. So we are here together with Dr. Gasangwa Patrick, and remember to do subscribe to our YouTube channel so that we will get other YouTube video on our channel by notification once we put the video. Thank you, you are welcome. Vaginal yeast infection normally is a type of fungal infection. Means that the body contains a kind of yeast which is called candida, which is the main cause of yeast infection. Some of clinicians call it candidiasis or vaginal candidiasis, but it's a yeast infection. So yeast normally is a type of fungus. So when the yeast is in balance with your body, there's no problem. Means that the yeast in balance with the body will maintain it so that there will be no problem. So, but when your yeast is out of balance, it rapidly grows and you get the yeast infection. Means that the yeast infection develops once the yeast is not in balance. A yeast infection causes burning, itching, redness in your vulva. This is the outside parts of the vagina, and it can change the vaginal discharge. So a yeast infection can be a sexually transmitted infection. So the name for that vaginal yeast infection, some clinicians or doctors call it vulvovaginal candidiasis or vaginal candidiasis. So a vaginal yeast infection is a type of vaginitis, of course, a condition where the vagina is swollen, painful, and possibly infected. So there are several types of vaginitis, but vaginal yeast infection is one of the most common. So how the vaginal yeast infection look like? So the way your vulva look and feels and the type of discharge that comes from your vagina, it may change if you have a yeast infection. The area of skin just outside your vaginal opening may itch and burn. So the itching and burning can feel worse when you pee or have sex. So some of the patients with yeast infection have painful vaginal intercourse. So even the vaginal discharge may become thicker, but it shouldn't smell different. Not everyone experiences symptoms of yeast infection at the same rate. Some have a symptom, others don't. So who gets vaginal yeast infection? So anyone with a vagina can get a yeast infection. It means that any woman, any girl can have a yeast infection. So they are most common after puberty and before menopause. Certain factors can put someone at high risk of developing yeast infection, but yeast infection are very common. Means that there are many cases of yeast infection, but some and most of them they are treatable. This is a good news. Yeast infection, they are treatable infection. If treated, don't last longer. So how common are vaginal yeast infection? So normally up to 75% of women or people assigned to female at birth will have at least one vaginal yeast infection in their life, and over half will get 2 or more of their lifetime yeast infection. So yeast infection is the second most common cause of vaginitis. Remember that the most common cause of vaginitis in the woman is bacterial vaginosis. We will talk it in the coming video as it will be accepted. So there are some factors that can increase the risk of getting vaginal yeast infection. Some of them are prolonged use of antibiotic, use of birth control pill, and some steroid. And also to be pregnant is a risk of developing yeast infection. Also some having a diabetes mellitus also is a risk. Other risk like sitting in the wet bathing suite, not changing your sweat clothes, also it can be a risk. Those are different risks of developing yeast infection. So the symptom and the sign of yeast infection, there can be a niche or burning sensation in your vagina and the vulva, thick white vaginal discharge with the consistency of cottage cheese. There will be redness and swelling of your vagina and the vulva, small cuts and thin cracks in the skin of your vulva because of fragile skin in that area, and even a burning feeling when you pee. Some cases another symptom of vaginal infection can be pain during sex. So you can have painful sexual intercourse due to vaginal yeast infection. How is yeast infection diagnosed? To diagnose yeast infection, a healthcare provider or a doctor diagnose it by doing some lab test. Here we do the urine analysis, where the laboratory technician will identify those yeast on the microscope, and at that time the infection will be confirmed that the patient had yeast infection. So you can ask yourself, why do vaginal infection happen? Why? So the reason behind, for example, based on the risk mentioned above, once you are taking antibiotic that treat some infection in your body, so it kills good bacteria in the vagina, known as normal flora. So good bacteria keep the yeast in check. So the balance shifts without good bacteria, leading to a yeast infection. So once you are taking antibiotic for prolonged time for different type of infection, those antibiotics can reduce the balance of good bacteria so that the yeast balance will change. So once the balance for yeast changes, the bacteria, the yeast can there be overgrowth of the yeast that cause vaginal yeast infection. And even also during pregnancy. As you know, during pregnancy, anything that disturb or change your hormone, the balance of candida in your vagina, this includes being pregnant, using birth control, normal change, even also during menstrual cycles. So once the balance in the yeast has been disturbed, there can be overgrowth of yeast leading to yeast infection. Also, even having a diabetes mellitus, means high blood sugar, can impact the bacteria. So once the bacteria, those are good bacteria known as normal flora change, even the yeast balance will change. Once the yeast balance change, there will be overgrowth of the yeast. So how do you treat yeast or vaginal yeast infection? There is medication known as antifungal medication that treats most of yeast infection. The specific medication depends on the severity of infection, of course. So the doctor, doctors will prescribe to the patient best treatment based on the symptom and even on the condition that they have. So antifungal medication will work by fighting yeast overgrowth in the body of the patient. Medication can be either oral or topical, or even there are vaginal suppository that we apply in the vagina. So those are three types of route you can use. We use as doctor to treat vaginal yeast infection. You can take oral, antifungal, like fluconazole. Also, you can use vaginal suppository like miconazole or teconazole, and even topical antifungal also can be used. So if you are using those topical antifungal or anti-yeast infection, you shouldn't have sex until you are finished the treatment. Sex can cause more irritation, and certain antifungal medication can weaken the materials used even in the condom and the diaphragm. Remember that. So once you are using anti-yeast drug or antifungal to treat yeast infection, you have to abstinence for doing sex during that period to avoid the complication. So those antifungal drugs can be used for like 7 days, and even there is some vaginal suppository that are used for 3 days. So it depends on the condition and the symptom of the patient, and the medical doctor who decide on how long we have to use those antifungal drugs. Here you can ask yourself, how long do yeast infection last? So most yeast infection clear up with medication after a few days, but may take a full week. More severe cases even may last longer and take longer to treat. So make sure you use the medication as directed by your doctor, of course. Do you think yeast infection can go away on its own? The answer is no. A yeast infection can go away on its own. Only medication or antifungal that treats yeast infection will treat a vaginal yeast infection. If you have a yeast infection, you don't use the drugs or antifungal drugs, the yeast infection will stay there. So how can we reduce the risk of developing yeast infection? So there is some of the lifestyle changes that can help us to reduce the vaginal yeast infection. The first one is not douching. So douching kills bacteria that actually control the fungus. It means douching, washing inside the vagina with soap, avoiding use of female deodorants. Also avoid using or wearing cotton underwear or loose fitting clothes, or avoid using water-based sexual lubricants, and even you have to keep your sugar in normal range if you have diabetes mellitus. So how or what should I do if I have a frequent yeast infection? So if you have a frequent yeast infection, you have to test to confirm that you have vaginal yeast infection. You can test blood sugar test to see if you have a diabetes. You can do HIV test to see if you have HIV, because patients with HIV and even diabetes mellitus, they are at high risk of developing repeated episodes of yeast infection because they have a weak immunity. So the last question, does my sexual partner, so if a patient has a sexual partner, is it necessary to treat the sexual partner if a female or woman have yeast infection? The answer is yes. It's possible to pass yeast infection to your partner. So if your partner has a vaginal yeast infection, they are at risk and should watch for symptoms. So if your partner doesn't have a vagina or have a penis, the chance of passing yeast infection to them are quite low. Means that if a man have a yeast infection, there is a high risk of spreading those yeast infection to his wife. But if a wife has vaginal yeast infection, the chance of spreading those yeast infection to her husband is very low. Thank you for watching. I think it is the interesting topic. So remember to do subscribe on my YouTube channel so that we will see other YouTube video in the future by notification only. Thank you very much. Bye bye.